Next, we're going to look at access and appeal changes that do not affect grandfathered plans. So this is the third through the fifth area that does not affect a grandfathered plan. Emergency services are now covered on an in-network basis. What happened for many individuals is they would go into an emergency room, get treated, and then when they started getting their bills, they would notice they got bills from physicians that were out of network, and that was a lot of additional expense for an emergency situation that under healthcare reform, they're saying, you know, they should have been treated as in network, and they would be required to now, unless you're a grandfathered plan.
Okay, that's pretty good, because when you go in to be treated, especially in an emergency situation, you don't have the presence of mind, nor really should you, to say, Doc, are you in my plan or not?
Exactly.
So now it just makes it's more about treating the patient and treating them as they were in network, regardless of if the physician really is or not.
And absolutely a benefit of being covered under a health plan, so you have those in-network discounts that are appropriate.
Okay.
Under B, enrollees can designate any physician as their primary care doctor, and that was an issue years ago where they wouldn't allow like a gynecologist or a pediatrician to serve as a primary care physician. So it gives better access, and it's better for the individual to have that option. The final area is the development of standardized appeal processes for all insurance companies. And there are criteria now that the insurance carriers have to abide by for internal reviews and external reviews. That is all in the area of protecting the consumer. Okay. Now we're going to move into the areas, the provisions that affect all groups that renew after September 23rd, whether or not they're grandfathered. Even if they're grandfathered, these things are going to apply to them. The first one and foremost is that there's no lifetime limits anymore. You know, as an employer, that typically you had a lifetime limit of $1 million or $5 million. Now it's unlimited for everybody. And there's annual limits are prohibited for essential benefits. Now they've actually defined that very broadly, Gina. The essential benefits include emergency care, hospitalization, maternity, newborn, pediatric, chronic disease management, prescription drugs, lab services. So, you know, there's almost everything that's in that classification for essential benefits.
So again, the lifetime limit is on an individual, is under a covered individual. It's not necessarily just the plan for the company.
That is correct. There's unlimited benefits on an individual basis.
Okay.
Yes.
Okay.
Now, I just said that there's annual limits are prohibited, but guess what the government did?
What now?
They said, well, we're going to cut some slack, and there's a transition rule that says that reasonable limits can be placed on essential benefits until 2014. I bring this up because we're seeing a lot of these transition rules come in where they're cutting some slack for the carriers, the insurance companies, and that's interesting because you just think that it's finalized and it's changed.
So is that a good thing, or is it still too early to see?
Well, fortunately, I think that most of the carriers have already made these changes to comply with the law, so they're not going to go back and make it, you know, more lenient.
Okay, so they're not going to have a do-over. They're going to leave things existing.
Exactly. They've already made the changes, and they're going to stick with that.
Okay. What about when I heard about covering adult children up to age 26?
That is a great thing for children that are on their own. What's interesting is I get a question a lot of times because the state of Florida, you can cover a child up to age 30 under many plans, but they have to be financially dependent on their parents, or they have to be full-time student, and they have to typically be claimed as a dependent on the parent's income tax return.
Okay.
Now, what's different with the federal law under the health care reform is that these children, adult children up to age 26, they can be married. They can be living in another state. You know, Gina, they can actually have jobs, and they can have children, and they can still be covered under the employee's plan, as the parent's plan.
Now, would the dependents of that adult child be covered, or just the adult child?
No, they're not going to extend it to spouses or children, but that adult child can be covered under the parent's policy, and as your group plans renew, that's something that needs to be highlighted for your employees, and you're going to see some new enrollees, those dependents that have been taken off in the past because they were 23, 24, 25. They can now be added back on. So you want to make sure you catch those when your plan renews.
Okay. And if one of your children up to age 26 gets a job where they are provided with coverage, can they still be covered by your plan, or once they are eligible for their own coverage through their employer, they have to, then they're not eligible for this benefit?
You know, Gina, I am so glad that you asked that question, because there is a differentiation here between the grandfathered plan and non-grandfathered plan. If you are a grandfathered plan, you do not have to allow those dependents on your plan if they're eligible for a group health plan through their employer.
Regardless of how much it costs.
Regardless of how much it costs. If they're eligible for a group plan, you do not have to allow them to be added to your group plan. However, if you're non-grandfathered, it doesn't matter. They could be eligible for their own group plan under their employer, and you would still have to add them on your group.
Okay.
So we're going to talk about no pre-existing conditions for children. And we're talking about children being eligible for coverage up to age 19. And, you know, under a group plan, as long as you've had continuous coverage without the break, your employees are going to be coming on, and the dependents are going to be coming on with a waiver of pre-existing conditions. But there's two scenarios where this is going to be beneficial to your employees regarding their dependent children. Number one would be if they did go without coverage over 63 days, then they don't have that letter of creditable coverage, and they're going to be subject to pre-existing conditions. Well, their children no longer would be subject to that.
Okay.
The other exception that I can think of is if a employee declines the coverage for their dependents and then adds them on later as a late enrollee, typically they're subject to pre-existing, and that would not apply.
Okay. So this can be for, even though the slide says for 19 plus, that could be for your children up to age 19?
That is up to age 19, yeah. So that is not over 19, that is up to age 19. And unfortunately, a lot of Americans were under the impression that everybody could get coverage without pre-existing conditions regardless of their age. But for ages 19 and above, and I think that's probably why I put that in there, for ages 19 plus, they're not going to be able to get coverage without the pre-existing conditions until 2014.
Okay. So you can cover the 26 up to 26-year-olds, but if they have a pre-existing condition, then they can't be covered till 2014.
Yeah, they're going to be subject to pre-existing conditions if they're over 19, but they can be added to the plan. That's exactly right.